Kathy Dietz, thanks for the question. Why am I going to Arkansas to have my SFOT done? I live in Boston. Why am I going all the way to the middle of nowhere, Arkansas, to have this treatment? A few reasons. It's actually it's a trickier question than you would think. First of all, SFOT is a kind of a rare thing. It's not done at not every periodontist does it. Dr. Michael Curry in Arkansas does it. So check. He actually does this procedure on a regular basis, which is important. I wouldn't want it to be done by someone who does it, once a month. I would rather someone who does this on a regular basis do it, as would be the case with any surgery. Number two, it's a good price down there. I heard of a different dentist who does the treatment in Chicago, and the treatment is almost 1.5 times the cost. So the whole treatment down in Arkansas is affordable compared to elsewhere. And I was quoted in the $600 to $8,500 range. That includes anesthesia, that includes everything. So that's much cheaper than I've heard of it being done elsewhere. Number three, Dr. Curry works with an orthodontist named Dr. Rick Robley, who uses the MSE. So I wouldn't want to do SFOT with a provider who hasn't done it on someone who's done MSE, because when he flays open my gums and he's looking at my alveolar ridge, he's not going to be caught off guard by the fact that there's a split in my suture with some, scar tissue or very young, thin, new bone that's going to be in that space after my MSE procedure. I'm now a few months following my expansion. Things are definitely healing up, but there's definitely going to be a noticeable kind of trauma or split there. Remember, that split is like 1 centimeter wide in my case. So Dr. Curry has seen something like that before, because he's treated MSE patients before, and so he won't be, he'll know how to handle that. And he's already confirmed that that's not an issue, and that it's not too soon following my MSE expansion to do SFOT. So those are the three reasons. Oh, and then finally, because my orthodontist, Dr. Nuaz, referred me to Dr. Curry directly. Dr. Nuaz has done classes with Dr. Curry, I believe. He knows him personally. And he said a year ago, when he suggested I do this for the first time, he said, you should go do this with Dr. Curry. He didn't even mention anyone else. Dr. Curry is like one of the guys for this. I mean, if you look up SFOT on Google, the first paper that comes up is co-authored by Dr. Curry. So he's kind of the star at this. And I trust Dr. Nuaz with all things at this point. And if he says Dr. Curry, then I'm doing Dr. Curry. So for all of those reasons, I'm going to Fayetteville, Arkansas, I believe, to do this procedure on January 8th, and then subsequently to expand the maxilla in the mandible to finalize my occlusion and bring an end to, what's going to end up being 4 long years of orthodontic treatment for me. So that's it for now, Kathy. I hope that answers your question, and I hope you're well. Peace out.